All right, everyone, welcome. I'm Dr. Sally from Regenexx Pittsburgh. I'm just going to do a quick intro here for you so you can see my face. Welcome. Today I'm going to be talking to you a little bit about Regenexx and how we're using your own body's cells, stem cells, blood platelets, and some other treatment variances to help with treatment of pain, avoiding surgery, and just overall improving your general musculoskeletal health. So let's go ahead and get started. So who am I? Like I said, I'm Dr. Jesse Sally. I did all my undergraduate education and my medical school education at Virginia Tech in Blacksburg, Virginia. I came back to Pittsburgh and finished my primary specialty in physical medicine and rehab and additional fellowship training in sports and spine care and finished that at the University of Pittsburgh as well. I'm an avid snowboarder and cyclist, so very familiar with sport-related activities. This is our practice. My senior partners, Dr. Paul Lieber and Dr. Mark Adelsheimer. We have 5 locations throughout the Pittsburgh area. Our main office is located in the Fox Chapel neighborhood of Pittsburgh, but we also have locations in Monroeville, the south in Bridgeville and Washington, and out to the west of the city in Sewickley. So let's talk a little bit about Regenexx as a company. So Regenexx was really the first organization to start using stem cell treatments for orthopedic problems in humans successfully. This started around 2005. Chris Centeno was kind of the pioneer of this therapy treatment in Denver, Colorado. Regenexx across the nation has about 62 to 65 providers. I know they've added a couple more on this year, so the network kind of continues to expand, but we have a lot of different locations all across the nation. We've done the most stem cell procedures in the United States and really worldwide in terms of our network and all of the treatments that we've done in our database. It's safe. So safety factors have been checked with this across multiple different factors. There's been papers that have been written in over 2,000 patients that we've done these procedures on to prove that the safety is very efficacious and definitely there. So we can perform these procedures all with very close guidance of the procedure. So everybody that's in the network is very highly trained. Everybody does these procedures with a lot of good guidance and care, and the outcomes are definitely good. And it's the most well-researched stem cell treatment throughout the world. Regenexx has published the majority of the data on musculoskeletal care with stem cells and orthopedic care with stem cells. So most of the research that goes into this is guided by a lot of the Regenexx network in general. So big question is why you're here. So you're here today to listen to me talk about what kind of treatments we offer, but why? Well, pain is usually a big driving factor for most people. And a lot of people also just really want to know what their options are. But the big thing with a lot of people is I don't want to have surgery. I don't want to have to deal with the downtime that comes with surgery. I don't want to be off of work. If you're older or if you have some other medical issues, maybe you might not be a surgical candidate. Some people don't want to rely on medications. So some people have been told they don't have another choice but to kind of live with it. And that's not necessarily the best option for a lot of people. Some people just aren't ready to slow down. You want to maintain your functional levels. You want to maintain your quality of life. And you just generally want more from your life. So that's what we're here to talk about and hopefully provide. So the next step is really what are the obstacles that get in the way of achieving those goals? One of the biggest things with these procedures is that they're not covered by insurance in most cases. So money for people can be a factor. A lot of people worry about the time that it's going to take to do the procedure and to recover from the procedure and how long will I be down from my activity and what's that going to look like in terms of, again, money and time off of work. There's a lot of confusion for people about what these procedures actually are, what we offer, how the procedures are performed. Are they painful? Are they safe? And that generates some fear in terms of people worrying about what to expect from the procedure, what to expect from the outcomes. And then patients also want to know that they can trust the person that's doing the procedure. These are very high-end procedures. They're very detailed, and they require a skilled person. So we want to make sure, I'm going to make sure hopefully through the entirety of this presentation that we touch on all of these issues and hopefully clarify them as much as possible for you today. So one big goal for today's talk is to really just help explain Regenexx as an alternative choice in your care for dealing with musculoskeletal and orthopedic issues. To help you discover if you're a candidate for these procedures, is this going to be the right type of treatment for you, or at least can we guide you in the right path for this? And to hopefully help get you scheduled with one of us, with one of our Regenexx expert physicians, so that you can get all your questions answered in a face-to-face encounter, and we can go over what treatment would be the best for you. So throughout the talk, we're going to talk about what Regenexx is, which we already kind of touched on. We'll talk about some of the current options in terms of what we offer for care. We'll talk about interventional orthopedics and what the idea behind that type of a treatment is. We'll talk about the differences in terms of Regenexx just as a provider network and how we sort of differ from a lot of the other options out there. We'll talk about who these types of treatments are for, and we'll kind of touch a little bit on some of the results that we see routinely. So what is Regenexx? Regenexx is an alternative treatment for orthopedic surgery and pain. We are not surgeons. We are trained in musculoskeletal medicine, and we do interventions only with needles and not with any open incisions or sutures or cutting anything out. Interventional orthopedics is the moniker that we've kind of dubbed ourselves with. We are doing treatments to address orthopedic problems, but we're doing it interventionally with needles rather than surgically with big incisions and replacements and cuts and scalpels. Orthobiologics are the name of the cell types that we use. So anything involving your body's own cells. This is an advanced regenerative medicine option. So it takes, like I said, a very highly trained hand and an advanced skill set to master and perform. And it's a trusted alternative for orthopedic surgery. And that's been seen across a lot of our safety measures and outcomes in our national database. Regenexx, you can sort of Google Regenexx across multiple different media platforms. There are testimonials across the internet on multiple different sites, YouTube videos. There's a lot of information even on our website about it. But there's a lot of different people that have had these procedures done, and a lot of different information on a lot of different venues. But I'll give you all the details in the presentation today. So if we think about what the current options in orthopedic care are for most patients that are just going through the system, a lot of patients start out more with a pharmacological approach to their treatment, whether that's anti-inflammatory medications, Tylenol, other over-the-counter medications, supplements. Some patients have even gone as far as opioids in instances where they have more pain. There are some other non-surgical interventional options like steroid injections or hyaluronic acid injections, the quote-unquote rooster comb shots that most people will refer to. There's also nerve blocks, different types of bracing, chiropractic care, PT, the list goes on. Then we kind of jump straight to surgery. If some of those other non-surgical options don't work, people either say, well, you just have to kind of live with it, or the next step is going to be we have to take something out or do a scope or replace something or do something that requires more repair and more risk. So in terms of like the pharmacologic options, these are basically, your typical go-to in the medicine cabinet, but these are really Band-Aid treatments at best. They block some of the pain, they block some of the inflammation, or they mask the pain. And there are a lot of more serious side effects with these types of things. Anti-inflammatories, as we know, have started to cause more cardiac and kidney issues. Opioids, obviously, there's a big addiction component to that and problems with that with tolerance. And with steroids, we know that there's additional tissue breakdown and hormonal imbalances that can come along with that. So these aren't problems to be taken lightly or side effects to be taken lightly. So definitely something to consider in the care. Other non-surgical options, the steroid injections, all these other things that I've mentioned, definitely effective in terms of pain relief, but definitely short-term results. And usually these give diminishing returns over time. The more times you introduce a steroid into the joint, the more that cartilage kind of continues to break down, and the more problems with pain and additional arthritis we see as time goes on. And then again, steroid injections repetitively have negative side effects that can affect more than just the joint itself. So when we look at just the pie chart across all these different surgical options, you can see it says 53% of surgeries have been shown to be ineffective in clinical trials. And basically what that means is the surgeries that they're doing aren't necessarily controlling the pain that the patient has or giving them any additional pain relief after the fact. And so that kind of deems a lot of these things a little bit more ineffective in terms of long-term pain management and care. There are definite risks that are involved in surgery. Obviously, if you start opening things up or taking things out or replacing things, there are complications that can come along with that. It doesn't always work, as we just said. If you take something out and replace it with something that's not meant to be there, there is a chance that that's going to fail in some fashion. And you can't undo it. I always tell patients, you can always go from A to B, but you can't go from B to A. With these types of treatments that we're talking about, you always have the option to go forward from a surgical standpoint, but it doesn't eliminate your ability to come back. So interventional orthopedics, as I said before, sort of relates to how interventional cardiology is performed today. It used to be if you were having a heart procedure, you had to cut open the patient's chest, open up the ribs. That was a very involved, very complex procedure. Now, a lot of the cardiology procedures are performed through a little needle poke in one of the vessels, and they feed a catheter up to the heart, and they can do a lot of their surgical procedures that way. So instead of doing these large, complicated, risky surgeries, now they're downgrading it to a much more interventional approach. And that's the same way we've done with our orthopedic management. We've replaced these complex replacements and complex surgeries, even more invasive scope procedures with simple needle injections under image guidance to try to make this a lot less complicated and a lot less risky. There are over 85 different types of injections that we can perform. So our options are highly variable. We have a lot of different ways that we can approach the care in terms of how we manage different individual problems. And again, it's your own cells. So everything that we're using is coming from your own body. So there's a low risk of any adverse effects with that or your body responding negatively to it. So if we look at it on the timeline spectrum, in terms of simple injections versus surgery, most of the time when you think about simple injections, it's just going to be one single injection into the joint. Most people have had this experience with orthopedics. Sometimes they've had it with their primary care physician. A lot of the time, these injections are done without guidance. It's usually just landmark-based or a finger-based approach. If we talk about the other 4% of U.S. physicians, that's where some of them are doing it under ultrasound guidance. But then if we look at the 1% of U.S. physicians that are doing interventional orthopedics within the Regenexx network, the interventional approach becomes a lot more complicated. What we're doing is we're looking at all these different joints, and we're looking at all the different parts that help to provide stability and movement in these joints. And we're addressing all of these different parts individually, depending on what the patient has and what the patient is experiencing. So it's not just one simple injection to try to fix all of the problems. It's going to be multifocal, and we're going to address everything that's affecting the joint and the joint motion. And then obviously beyond that in the spectrum of surgery, again, we're hoping that we're not having to get to that point. So this is a new option. We're putting this right in between those other non-surgical options, the injections that are basically just covering and masking pain, versus going straight to surgery, which is an option a lot of people don't want to involve themselves with right off the bat. So we're a good intermediary between the other types of injections not working and not going forward with more invasive surgery. The biggest differences when it comes to Regenexx and how we provide treatments, orthobiologics is kind of a wide variety of treatment options. There are different types of growth factor injections. There are bone marrow derived stem cells. There are adipose or fat derived stem cells. There are amniotic matrices, and there are concentrated platelets as well. So there are all sorts of different elements that we can use when we talk about these injections. So it's not just one specific cell type, but 80% of what we do is probably based on platelets, blood platelets, and not so much stem cells. About 20% of the procedures that we do are more stem cell related. So it's not always the majority stem cell treatment. You know, a lot of the issues that we treat can be completed with platelet-based treatments. So there's a significant cost difference, and not everyone needs the stem cells, but we definitely address that on a case-by-case basis. We make sure that whatever treatment we think you need, that's the one that we're going to recommend. Different structures addressed. Basically, all of the Regenexx treatments are geared toward musculoskeletal care in most cases. That includes joints, ligaments, tendons, meniscus treatments. The spine is one that we do very commonly. Treatment actually into bone, where areas of bone are becoming damaged from significant arthritis. And with the spine, that also includes some nerve-based treatments for patients that have nerve-related pain, disc-related pain, carpal tunnel symptoms, all these different types of things that can be nerve entrapments as well. Conditions, you know, a lot of the musculoskeletal treatment is guided by arthritis and arthritic change. That's definitely the most common. But tendinitis, chronic or acute, any type of torn ligament structures, spine pain or spine instability, even post-operative spine pain, we treat in a lot of cases. People that have had fusions, people that have had laminectomies, and all these different things. There are definite treatments that we can do around that to be helpful. Disc-related issues, like I said before, meniscus tears in the knee or in other parts of the body. And again, damaged bone that kind of comes along with more severe arthritic change. Nerve damage, like I said, in the setting of carpal tunnel or other spine-related treatments, and even long-standing issues in some cases that have happened over time. The specialists, meaning us as providers within the Regenexx network, it's important that your doctor is an expert in musculoskeletal care. All of our physicians within our practice have been trained at a very high level in terms of musculoskeletal and spine management. We only have physicians that are performing these procedures, no nurse practitioners or physician's assistants or chiropractors or other providers are providing the treatments to you. That means that you only get an expert physician with the knowledge and skills and experience that you need to perform these procedures at a very high level. We're not dabblers. We're not guys that have gone and through and trained with this on a weekend. We've been doing this all through our medical career, and we're definitely performing it at a high level. So this means that the right doctor who can make the right diagnosis and provide the right directed treatment is going to be the key to more positive success and positive outcomes. The cell source, why this is important, we're thinking about safety, viability of the cells, and then obviously compliance with the FDA. With our treatments, you're only going to get your own bone marrow cells that are alive and properly dosed. We're not using stem cells from any other sources, no other amniotic stem cells or umbilical stem cells or things that are not from your body or from fat or from other third-party sources. This means that you're getting the most well-researched product available, and that's going to give you additional peace of mind in terms of how good the results are going to be and what kind of value you're getting for your treatment. Harvesting, this is definitely important because when you harvest cells, you want to be able to get the most cells, the most living cells, the most viable cells from your body. And that source is without a doubt from the bone marrow. There's been some conflicting argument about the fat, but in most research, you can definitely get way more cells harvested properly from the bone marrow than you can from the fat cells. So that means that you're getting the highest dose of cells possible. You're getting cells that are harvested with the best technique, which is going to give you the best, most viable cells. And it's going to obviously give you the least amount of pain when we're doing any types of extractions. We take your comfort very seriously when we're doing these procedures. So we want to be able to get the best product for you at the least cost to you. So you then we know how to extract those cells very effectively from your body. You get the maximum dose for the greatest success, and again, with the least amount of pain. Big difference with Regenexx as well is the holistic approach that we use in terms of the treatment and the treatment approach. We're not just looking at the joint itself. We're looking at everything around the joint, how that joint moves, everything that's helping to support that, and then looking up and down the chain. If it's the knee, what's the hip doing? What's the ankle doing? What's the spine doing? And we're putting all of those things together, from the structure, the joint articulation, the nerve supply, the muscle quality, and the symmetry of the joint, to make sure that we're compiling the best possible treatment plan to make sure that that joint is getting the best outcome possible. So in terms of who you can trust, there are going to be all sorts of providers that you can find whenever you do Google searches, whether it's in the Pittsburgh area or nationwide, wherever it may be. There will be all sorts of provider clinics that will pop up, and you have to know who you're dealing with and what kind of treatment you're dealing with when it comes to people being able to perform these procedures and perform them at a very high level. The Stem Cell Review, stemcellreview.com is a great website to go to. You can type in Pennsylvania as the state, and it will bring up a lot of the different stem cell providers across the state or whatever location you're at. And you can rate, or it'll rate how good all of these different organizations are in terms of how well they perform their procedures, how good of a quality their imaging is, how good of a quality their product is. And as soon as you go onto this website and type in Pennsylvania, Regenexx pops up as the top one in terms of the quality of the treatment that we offer. This slide is very important because it speaks to, I get a lot of questions from patients about umbilical stem cells, and aren't these better because they're from, younger sources or babies, and they're just better stem cells. That's all not true. And the research has proven that time and time again. The umbilical stem cell formulations, if you look at this picture, on the left, all those purple dots are stem cell cultures that have grown from bone marrow samples harvested from patients all within their 50s and 70s. The slides on the right are stem cell growth from formulations of umbilical stem cell products. As you can see, there's absolutely no growth at all whatsoever in those cell plates on the right side. All of these umbilical cord stem cell products have never proven in any research study in labs, including very high-level college studies, to show any cell growth or any live cells in these formulations. So, take it very seriously or with a lot of caution if somebody tries to tell you that umbilical stem cells are going to, be better in terms of your healing, or just better stem cells in general. There's never been a study or an outcome study that has proven that. Red flags to look at when you're talking to different providers about treatments. If there's a lot of emphasis on discounting or financing, that's definitely something to raise a red flag about. Obviously, we try to help patients out however we can, but it's not going to be like a used car sale in a lot of ways. If they're touting their treatment as a magic cure-all for all of these different things, that's definitely something to raise a flag about. We only claim to be able to treat musculoskeletal issues. We never talk about multiple sclerosis or Alzheimer's or any of these other types of diseases We stay in our lane and we know what we treat, and we know that we treat it very well. They say that everyone is a candidate. We base our candidacy on our evaluation of you, looking at a lot of different factors in terms of your exam, imaging, past treatments, and all these different things. If we feel like you're a candidate, we're definitely going to tell you what our expectations are with that, but by no means do we ever think that everybody is going to be a candidate for the same treatment all the time. If they're calling amniotic matrix cells or umbilical cord cells a stem cell treatment, again, any study that has looked at amniotic cells or umbilical cells has proven that there is no viable stem cells in any of those formulations whatsoever. So it is not a stem cell treatment. It's not a live stem cell treatment. Fat, there are some clinics offering fat stem cell injections, but to effectively actually extract stem cells from fat, you have to add an enzyme to those fat cells. And according to the FDA, that is actually illegal in the United States. So that type of a procedure, in order to adequately treat with fat stem cells, is not an option or is being performed illegally in some clinics. So as far as safety, I had mentioned that Regenexx is a very safe procedure. We actually have the largest published safety paper in the world. Like I said, it involves over 2,000 patients, showing outcomes in terms of any infection or any other negative complication. And, we're looking at less than 1% issues with anything on that across the board. Stem cells in themselves are actually antimicrobial. So essentially you're getting an antibiotic effect with the injections of the stem cells anyway. So the safety with this is hugely good. For the most part, the most common pain that people actually report is that they just get some pain at the injection sites. It's very rare that people will get any increased pain from any of the procedures that we do. There's usually soreness that comes along with just the procedure itself. But beyond that, most people don't report any significant pain issues at all following these procedures. So very comfortable, very easy, very little downtime, and definitely good results for you. So how these visits kind of flow with the PRP type treatments, so the platelet-based treatments, it's pretty much just an initial 1 hour evaluation and exam. We would have you follow up and do the blood draw and the injection on the same day. So everything happens all at once. After that treatment, probably about a week later, we would maybe start some physical therapy if needed. And then usually we're doing a 1, 3, 6 month, and then 1 year follow-up just to monitor progress. Usually with the PRP, people are seeing the biggest improvements in symptoms usually at the 2nd to 3rd month, something like that. For an actual stem cell treatment, this is a little more complex. Again, it's an initial about 1 hour visit for examination and history. And then there's 3 different treatments that are actually going to happen within about a week time frame to get the entire procedure performed. And day 1 is basically what we consider tilling the soil or preparing the joint for the treatment. The second day is when we extract the stem cells and then re-inject them, so planting the seeds. And then day 3 is using some additional platelet-based treatment to actually, quote unquote, fertilize those stem cells and make that treatment more optimal. Again, physical therapy usually starts about a week after the procedure, and same follow-up at 1, 3, 6 months, and then 1 year. Usually the biggest results in terms of healing with the stem cell procedure usually happens somewhere between the 3rd and 6th month in that time frame. Post-care physical therapy, with this, you're looking at about 60% less physical therapy than you would be with typical surgeries. We are definitely sort of like a do-it-yourself type thing. So in terms of, referring providers, we're not looking to, we're looking to try to give you the best experience individually for your physical therapy after the procedure. So we're trying to communicate with the physicians that that you come from. We're trying to basically manage that the best we can and make it so that we're giving you the best possible outcomes along the course of that recovery. So this procedure is basically for people who want to avoid surgery, which I feel like most people do. People that want to keep all their parts. So again, we're not looking to cut things out or replace things. If you don't have time for a lot of lengthy rehab or a lot of downtime, then this is the right procedure for you. Patients that don't want to have to be living on medications or opioids or anything like that. People that have had failed surgeries in the past and want something different, or people that have known somebody that has had a bad outcome with surgery. If you have medical contraindications that won't allow you to have surgery or won't allow you to have anesthesia for surgery, or if you're just too young for surgery. We have treated a lot of people. The youngest that I've treated has been about 14 or 15. The oldest person that I've treated has been 98. So we see people across the entire spectrum, but obviously for people that don't want surgery at an early age, we want to try to give them better options and better outcomes. So usually the results overall is less pain. People don't want to have to live with pain, so we're looking to take that away or diminish it as much as we possibly can. Increased function, we want to make sure that your body's moving the way you want it to or need it to. And if those two things are usually in place, then usually your mood's going to improve. If you can move better and you have less pain and you're sleeping better and all these things are in place, usually people just feel better. Also, it's nice to be able to get people off of pain medication in whatever capacity, whether that's long-term anti-inflammatories for arthritis or opioids for other issues. We're looking to get rid of that as much as possible if we can. And then obviously try to get you back to your preferred and active lifestyle in whatever capacity that looks like for you. You don't have to be an athlete. You just have to live the way that you want to live. And then, obviously we get a lot of questions on cost. I'll kind of give a brief rundown of what that looks like. For prolotherapy, which is a different type of regenerative treatment that we do that does not involve your cells. This is more for like mild arthritis or ligament instability or some other issues. That's probably on the lowest end of the spectrum, looking at anywhere from $300 to $650. Platelet-rich plasma is the sort of the next jump up. That's where we're using more of your own blood platelets for treatment of more arthritic issues, more high-grade tendon tears, things like that. Beyond that is more of our platelet-based spine treatments, where we're actually doing things in the epidural space, into the joints and things around the spine, trying to add some stability to that area. And then the upper tier is the stem cell treatments for more severe arthritic issues and other things that we would need that for. And again, this is a case-by-case basis in terms of how we approach patients' treatment. So the evaluation and your history and everything that we find on the exam is going to really drive the decision that we make in terms of how we approach this procedure for you. So what insurance will usually cover is things like your initial consultation. So any visits with us, any follow-up visits with us, any other imaging that we need or any other diagnostics, lab work, MRIs, x-rays, whatever it may be, and then additional bracing and physical therapy after the treatment. Insurance is not going to cover the regenerative procedures, so all of the things that fell onto that last list. But if you look at comparisons with certain insurance plans, copays, and deductibles that continue to stack up, you may actually be paying more for your traditional orthopedic surgery or other care. If it requires long-term rehab and all these other types of things, or God forbid there's a complication with it that you need to go back for more treatment. All of these things are very applicable when it comes to cost. So, and again, the treatment plan is very customized to your own care. So there's a wide variety of price difference that comes along with that. We have had some success recently with some self-funded employers looking at this treatment and using it as an option for their employees. So we're hoping to get a little bit more coverage with some companies across the area, and hopefully maybe more people will be looking into this a little bit more seriously. Hopefully that drives more covered lives across the board, but there's no way to really know that just yet. Right now, we're looking at about over 6 million people that are covered under these umbrella employers right now. And these are just a few examples of some of those employers. So we're definitely trying to build that up more and more with certain areas. And hopefully that translates into some better coverage for people. But right now, it's still in its relative infancy, and we're building that up as we go. So the next step for you, really, if you're interested, is to contact our one of our liaisons, Sarah, to schedule an in-house evaluation with myself or with one of the other docs, depending on your preference. The number's there. You can visit our website for any additional information, or you can check us out on social media. But all of all the information is there for you, and you can schedule a new patient exam for a regenerative evaluation. Again, these are all of our office locations. The headquarters is in our Gamma Drive office in Fox Chapel. I primarily see patients in Bridgeville and Washington as well. So patients from the South Hills of Pittsburgh can definitely follow up with me at either of those locations. And we're happy to see you if you would like. So I'm going to open it up now to some questions, and I'm going to try to address your questions as they come in. So feel free to do that, or to write any questions that you may have. And I'll even bring myself back up here so I can see everyone while we're doing questions. Any questions from anybody? Feel free. You know, that's what I'm here for. If there's anything more you want to know. Otherwise, if you don't have any questions for me, or if you think about anything moving forward, feel free to give us a call. You know, if our liaisons can't field the questions for you, I'm happy to get back to you as soon as possible, and we can address anything that we need to moving forward. Oh, I got one. Okay. Is the price per session or for the whole treatment? That's a good question. The price itself is actually for the whole treatment. So like I said, with the stem cell treatments, there are 3 treatments that are involved in that. The entire cost will be given to you for the whole treatment. Each individual part of that is priced a little bit differently, but the price is usually for the entirety of the treatment itself. Anybody else? There we go. Have you had any success with ACL tears? Yes, absolutely. We've had patients who have had acute ACL tears, athletes that have had treatment for issues that have happened just recently. In fact, I'm going to be talking to a young gentleman tomorrow morning about this very same issue. Yes, we've had great success with the ACL tears. You know, if we can catch it in the right instance and the imaging looks good, the chance of that actually repairing well is very good. So we're doing that a lot more and more as we go along, and trying to keep people out of surgery. Additional question, do you support the hips? Yes. And again, you know, this is and if the hips are bone on bone, can this treatment help? Yes. So in any situation where there's bone on bone arthritic change, we definitely have the opportunity to be able to help. You know, there are some additional conditions that we look at in terms of people's care in those settings. But even if you have bone on bone arthritis for any joint, it's definitely worth coming in and talking to us, because there are a lot of different things that we can do to help with that. So yes, even in that setting, we do get good results. How many 75-year-old women have had these treatment? A lot. You're probably actually in the vast majority of the patients that we treat on a routine basis. I'd say that a lot of our patients fall between the ages of 55 and 85. I'd say that's probably where the bell curve peaks. But again, you know, I don't want anybody to think that you're too old to have these treatments. Like I said, the oldest person I've treated is 98. Sometimes people that have, that are even higher in age tend to have better stem cells or more stem cells. So don't let your age be a factor in terms of how you think these treatments will go. Next question for bone on bone. Is it more typical to do platelet or stem cell treatments? Usually it's more typical to do the stem cell treatments, and that's just based on, the outcomes that we get in patients that have pretty severe arthritis. So I would say in most cases with severe bone on bone or stage 4 arthritis, the stem cells tend to be more effective. Do bone spurs on a bone on bone knee setting make me not a candidate? No. No, you are certainly a candidate. Bone spurs usually don't have a lot to do with the treatment. People have bone spurs in a lot of different areas. So that in itself is not necessarily a factor in terms of your outcome. And obviously we can talk about that a little bit more if we saw you for a live evaluation, looked at the imaging to kind of see what that really looks like. But in most cases, that's not a limiting factor. Again, for stem cell treatment, how long does it typically last? With the stem cells, we're usually seeing results somewhere between the time frame of 7 to 14 years. That's probably the expanse right now. So the middle on that is about 10 years. And everybody's a little bit different, but in terms of looking at these treatments, long-term outcomes across our national database, that's the numbers that we've pretty much seen have fallen between 7 years and 14 years. And these treatments are repeatable. So it's not like you can just have one treatment and then you can't have anything else for the rest of your life. Stem cells renew themselves. Stem cells grow again in your body. So they're always self-renewing. So you can get these treatments done, more than once. And even as you age, that age doesn't tend to be a factor in terms of the stem cells that we can collect and use. Percent of pain relief do you typically get? Depends on the joint, but I would say typically with successful treatments, we're usually looking at about 70 to 80% improvement. And that's variable for everybody in terms of what that looks like. But I'd say on the broad spectrum, that's probably the best number that I could give. If knee replacement definitely needed later, does having the stem cell procedure cause any issues down the road to having surgery? No. It doesn't limit your ability to have surgery in any capacity. If anything, we're hoping to help you avoid surgery for a long time. And in a lot of cases, what we're seeing is that patients that have successful treatments are not needing surgery as we go down the road. But yes, you can still have surgery even after having a stem cell or platelet procedure. Does insurance cover consultation? Yes, absolutely. Any visits that you have with me face-to-face, your insurance will absolutely cover that. Minus any sort of co-pays for specialist visits or deductible or anything like that, that we can't control. That's within your insurance. But as far as like actually sitting down with me, we take insurance for that, and we take most insurances, I guess I should say. There's a very, very finite few, but all the major ones, there's no limitations with that. Anybody else? Did I hit everything? I'm hopeful. I'm hopeful that this was informative for you guys. So if there's no other questions, thanks again for, here we go. The number to schedule the appointment, it's 412-963-6480. There's an option to kind of direct you into the Regenexx consultation line. So just follow the prompts whenever you get in there, and it'll put you right into Sarah's voicemail. That for Monroeville, so our main, the number is for our main scheduling. That all comes through the central office, but you can choose to be seen in Monroeville if you would like to for an evaluation. If we attended the webinar, should we still fill out the candidate form? Yes. I would fill out all the information that you're asked to fill out. It's definitely helpful for us, just in terms of knowing what we need to do and knowing how to track you, which is helpful in terms of just monitoring outcomes and making sure that we're doing what we need to do. Who's the doctor at Monroeville? Both myself and Dr. Lieber see patients in Monroeville. So you have the option to see either of us. Are new test results needed, or can older x-ray still be used? It depends on how old it is and if anything has changed in the time frame since you've gotten that x-ray. I'd say bring it. If you have it, bring it. And if we decide that we need any new imaging, we can always get that. So, at least we'd have a baseline to kind of look at and review. And we can make the decision whether or not we would need anything else or need to have any additional information. Great questions, guys. This is really good stuff. So I'm hopeful that it's definitely giving you the information that you need. Oh, thank you. I appreciate that. Thanks for coming. Thanks for attending. It's definitely nice for us to be able to still get you guys the information that you need, even in a time when it's kind of difficult to get people together and do this in sort of a common scenario. But like I said, if you have any more questions, feel free to reach out to the office and we'll be happy to answer anything that we can. Hopefully we see some of you guys for a visit and that we can be of significant help for you. But thank you for attending tonight, this evening, and hope to see some of you soon. Have a good night. Thank you.